Welcome back to everybody to the podcast. I have a great guest on the show today. Somebody I've talked to a couple times before offline, but now I was like, let's make it official and get you on the podcast. So we have Dr. Barbara Robles-Ramamurthy. I'll let you introduce yourself a bit, and then we'll kind of jump on in.
Yes, thank you so much for having me. It's a pleasure to be with you. I've been following you on social media and appreciate just the humanity that you bring to the conversation surrounding mental health. So thank you for having me. I'm a
Of course.
adult child and forensic psychiatrist. Been practicing in academic medicine over the past 5 years and clinically focusing on kids in juvenile detention, as well as doing a lot of advocacy work with kids who are going through immigration in some capacity, a lot of
Yeah.
work around asylum seekers. And more recently, I guess over the past year and a half or so, I've been entering the world of social entrepreneurship and trying to figure out what that means for a clinician who wants to mix the mental health knowledge and education that we receive as clinicians, but also put it to use with communities that are often overlooked by the traditional mental health model. Obviously, talking about immigrants, refugees, asylum seekers, and kids involved with the legal system. So that's my startup that's focusing on that a little bit. And then I'm also a mom and have two
Yeah.
little ones, a 4-year-old and almost 6-year-old. And I I guess the last thing I'll say, just because of my name, people often think I'm Indian, but I'm Mexican American. I immigrated from Mexico and married someone Indian, South Indian, and so I also bring a lot of that, you know, um, awareness and experience, personal experience in that, multicultural, multi-spiritual aspect of family life.
Yeah. Yeah, it's definitely like you're doing a lot of the great stuff. I know we're both child and adolescent psychiatrists. We're both non-white child and adolescent psychiatrists, which I think is like so important because kids don't come in one flavor. And we definitely need to have these different experiences, especially like with the population that you're talking about that are having issues with immigration stuff and asylum stuff and then forensic stuff as well. We definitely see a overrepresentation of non-white kiddos in that group. So it's like so necessary what you're doing. So
And same to
awesome.
you.
We try. All right. So I always start off with like a surprise question. And I was like,
Okay.
I was thinking before this, I was like, what is going to be my surprise question? Then it came to me. I was like, how much do you know about the background of like Mexicans and Indian or South Asian crossovers and love stories and the history that's been there?
Oh, wow. Probably not much. I think I know of a couple of couples who are Mexican Indian, marriages. But from a historical standpoint, please share your expertise with me today.
No, it was kind of funny because I remember doing some presentation back in like college. Yeah, I think it was about like the Asian American experience or Asian immigrant experience. And I'm, Punjabi, which is a state in India and Pakistan. My parents from the Pakistan side. And when there was this huge, what's called like the Punjabi diaspora, where everybody left, right? India and Punjab and Pakistan. And a lot of them ended up like on the West Coast and we're doing a lot of
Mm,
work over there, farming work over there, which is very similar to like um, life in Punjab of on the farms and stuff. And we kept I kept coming across and seeing and hearing, I didn't know like specifics, but there was like this huge like trend of Punjabis marrying Mexicans. And because of like the very similar cultural uh, ideologies and belief systems and strong families and everything like that, we all like spicy foods, right? So
yeah.
it's a natural kind of fit. So I was like, oh, this would be a fun little thing to throw in there.
I love that. Thank you for sharing that with me. My husband Chetan goes to Mexico and people are like, you could be my primo, compadre. And I go to India and everyone's like, she's Mexican. So absolutely, I think, from a humanity standpoint, we look alike and we eat very similarly and we love, I think, very similarly and support one another.
Yeah.
And so I think that collectivistic approach to living is very similar in both cultures. So that's definitely created a lot of unity in our family for sure.
Yeah, which is always good. So
Yes.
let's use that as a transition. So family stuff and unities and families, and one of the things I know when you were talking about was like family mental health. Um, we think about, we talk so much about like Americans' mental health and workplace mental health and children's mental health. We don't think so much about like family mental health. What does that mean?
Yeah. I love that you're asking this question because I think for me, it started at least 2 years ago that I had started using that term on social media very explicitly, calling myself a family psychiatrist, talking about family mental health. And that was very intentional because that is one of the things that I struggled the most as a child psychiatrist. When a child comes to see us in the office, especially for people like me, clinicians like me who are working in environments where, you may have 15 to 20 minute, at the most 30-minute appointments, which is a luxury, right? Um,
Yeah.
but perhaps only one caregiver is available, or perhaps, you just don't have access to a lot of collateral information and you're just really working with the child. Um, I felt that my work was very incomplete with just focusing on what the child was needing without truly being able to offer more to what the family was needing. And as you know, right, like kids come in and they're grieving. Grandma
Yeah.
died and nobody's talking to them about it. Um, Father just, especially the populations that I'm working with, father was just released from prison and that
Yeah.
sparked intense fear in the child. And they want the relationship with the parent. They want to talk about that grief. But the model that we have in place, very few can access the resources to offer that more holistic perspective. And so even within those restrictive models, I try to bring in this perspective to be more family oriented. And so, really, always kind of communicating with the families and caregivers as best as we can, right? So, at the
Yeah.
minimum, we should be doing this. But in clinical practice, what that can look like sometimes, right? Um, but it really prompted me to say, well, what do I want to do? And how do I want to tackle this need that I have to step away from just looking at the child individually and looking more holistically at the child? And so when I talk about family mental health, it's the interaction of how you as a father, how you're doing is going to impact how you interact with your partner and with
Yeah.
your children, how you are accessible to them to have meaningful conversations about their needs and their mental health, how you're going to respond. Like, mental health is not just the absence of illness. So, your mental health includes your own growth and development and healing journeys, right? So, if you're carrying trauma as a father,
Yeah.
how are you going to respond to traumatic events that may happen to your kid that are similar to yours, right? Are you going to shut them down or welcome the conversation? So it's that interaction of how we as caregivers, one, are available for ourselves and our kids, but also how do we incorporate our family mental health and wellness into our larger community and how we interact with those communities around us.
Yeah, it's so important because so many times, again, my main gig is child adolescent psychiatrist and very similar, kind of mostly doing outpatient work, but then I also do partial hospitalization programs. So we were able to spend 2 to 3 weeks with the teenagers. We get, we involve the family. And that's really, again, I've stayed in that job because I was like, this is a model that works, right? Versus like the inpatient setting where it's like, you're here for like up to a week and then throw some meds at them and get them out. You're like, oh, you're not suicidal anymore? Okay, go home. And then it's like, but what are we sending them to? Right. And even purely outpatient stuff, you have, again, similar to what you were saying, like one parent is the one who always takes them to the appointments. Like there'll be times where you keep hearing about dad, right? We keep hearing about dad. We keep hearing about dad. We never see dad. I never see dad. I've never met dad in my life. And then there'll be sometime like after 5 years, I may have dad come to appointment. I'm like, oh, who are you? And like, it's nice to meet you for the first time. And understanding, again, the impact of all these things that play a role in how the child, our patient, right, or one patient, how they're doing, and how it's so dependent on everything else that's going on in
Well,
their
and I
world.
love that you're sharing your setting and how, when we get trained, I think people perhaps may not know, but as child psychiatrists, we get trained in different settings. We're seeing kids in outpatient settings, inpatient settings, residential settings, and we get to see what a family-oriented treatment model can look like. The
Yeah,
problem, as you know, is that we are waiting until
yeah,
severe illness has occurred to require that level of care. And so when I talk about family mental health, from my perspective at this point, I'm talking about prevention, uh, early intervention care, so better supporting the outpatient settings so that we can not rely on higher levels of care later on. But even if we need higher levels of care, which is totally fine,
yeah,
what happens when they get discharged, right? And so we need to
right.
continue that family support from my perspective. I think that's so crucial.
You described it too when you're just saying like the 15-minute visits, 20-minute visits as like, and they just become, unfortunately, due to kind of outside forces, like, how's your medication? Any side effects? Okay, good. We'll see you in a month or 2 months. And you lose the aspect of like what brought us into the field, what made us psychiatrists, of being like, well, what's going on in your life? What's happening in your life? And we get these questions all the time from people. And then, of course, like on social media, people are like, oh, you just throw medicines. It's like, no, we're trying to look for everything else. We want to look for everything else. A lot of it depends on, and then, some of it's like our own kind of struggles with like, how much can we change? Like what are the things that we're able to change, or what are the supports that we're able to do? So taking that step back and having that approach of being like, let's approach this family way is the way to do it. Talk a little bit about how your own cultural background, right? Because even for myself, right? So I'm, again, Pakistani, and if I'm non-Spanish speaking or I'm not Black, and a lot of our trainings were always kind of like in urban settings where those are primarily the patients that we work with. But you have that, again, the benefit in a way almost of coming from the country and being there. So tell me a little bit about how your own cultural identity maybe kind of influenced you and got you into the field.
I found myself on a journey to medicine as a gift.
Hmm.
Let me put it that way. I was not planning to be a doctor when I was in high school, but found myself kind of joining these activities that were health related. My first volunteer experience was after sophomore year in high school, and I volunteered at a hospice. And um, there was a child there who
Yeah.
was in his teens and had been left there by parents who had been told that he was likely not going to make it. And
Mm.
I saw the power of community even in that kind of setting and place. And so a lot of opportunities led me to receiving a scholarship for medical school. So again, not in the
Nice. Yeah.
plans, happened beautifully. And I knew I was going to work with kids, and then loved psychology. So child psychiatry it was. I think where my culture kind of leads me to become the child psychiatrist that I am is that I'm seeking that connection, and I'm seeking
Yeah.
that more holistic, community engaging way of practicing medicine. That again, opportunities are lacking for that kind of practice, right? And so it does take a lot of creativity and perseverance to get there. But yeah, it's that collectivity and that willingness to involve family members. You probably hear on those like cultural humility lectures, like how like Hispanic patients love to bring the abuelas and the tias into the doctor's appointments. And it's, in a way, I mean, it might not be that ridiculous, right? But in a way, we are more collectivistic and family oriented. And so that's definitely
Yeah.
playing a role here.
How do you, and then one of the things that we know statistically and stuff as well is that, again, non-white people like ourselves, like we don't seek out mental health treatment. And there's a stigma, there's the stigma that's there about mental health, period, in general. Then there's like the stigma within, again, non-white communities about mental health and about stigma then about even going further about being like, oh, you're going to be a doctor, and like, oh, wait, you're going to be a psychiatrist. Why are you wasting this gift, quote unquote, right? Did you experience any of that, or how was that for you?
Um, Honestly, I think I saw it more from my medical school peers, that
Yeah,
stigma against psychiatry that we probably all went through. Um, from my family, I probably saw a bit more worry from my mom about how heavy the work could be. And it is heavy, but I think that
yeah.
many of us carry a gift to hold space for difficult stories and life struggles, right? And so we can do it fairly well and manage it very well. But yeah, I think mostly from my peers. Thankfully, my family was not, we didn't have the knowledge, but we had the openness to learn and
Yeah.
to hear different ways of dealing with things. And so when I became a psychiatrist and went into the field, I remember having conversations actually with my dad when I was in residency, and he was really welcoming of the idea of therapy and why it could be helpful. And so I think, when we talk about stigma in our communities, I
Mhm.
would like to hear what your experience has been as well. But I think a lot of us would say, yes, there is some stigma, but it's there for the US American general population as well. And when you engage
Yeah.
people in meaningful conversations about what mental health treatment can look like, they're generally welcoming of the idea and open to it. What have you found in your community?
It's been, I come from, my mom's a doctor, my sister is a doc, my cousin's a doc, it was something that was kind
Oh,
of like
wow.
preordained, preordained in a way. Like from day one, parents, immigrant parents being
Mm,
like, you're going to become a doctor kind of deal. That's brainwashing that goes on. Um, but part of my story is like, I was initially like in dental school and I failed out of there and then was like, what do I do with my life? And went to the Caribbean for medical school and started, got that second chance. And, I
mm,
was kind of saying in retrospect, I failed up. Not to, disparage any of my dentist colleagues or my old classmates, like they did all right too. Um, but no, there was, again, similar to what you're saying with the stigma that was there. A lot of it was within the medical field. I remember like during my surgery rotation being on a case with the surgeon and they're just like being like, oh, what are you doing, what are you going to do with your life? I was like, I'm going to psychiatry. And again, this is an Indian surgeon and he's like, why are you wasting your life, why are you wasting your education, why are you throwing that all away to go into psychiatry? You should go into like surgery like me, of course. Or other kind of statements like that. And then even within family members, my cousin who was a cardiologist would
mm,
say things like similar kind of comments. My uncle who was, similar kind of comments like, what is this? Why don't people like, what is depression? Depression isn't even
mm,
really real. Like, what are people worried about? Like, so again, the dismissiveness about mental health struggles as a whole. And, again, similar with like substance use, it's like, why don't people just stop using
mm,
drugs and like they should be fine? So definitely we hear that stigma that's there. And then even like within community wise, like, we have an underrepresentation, I think, in
mhm.
people who seek out the
Yeah.
services, right? Like, and then, I'm part of my background too is like being Muslim and, the whole aspect of substances and things like alcohol and
Mm,
etc. are like, well, that's haram, that's forbidden in Islam.
mm,
So nobody drinks. So how are you serving your community by working in
mm.
alcohol? And I was like, trust me, there's plenty of Muslims who are drinking and have alcohol issues. And some along those
And I
lines.
think
So
that's why our voices are so important, right? Because you can understand that faith-based belief system and culture and why that might lead somebody to engage in these substances once they're in the United States, right? Where it's
right,
easily everywhere, it's accessible. And but also understand the shame and hiding that may have to happen because um, the
yeah,
culture is not aware of how this can occur and why it happens.
yeah. What do you think are some of the challenges unique to like Mexican, Latino, Latinx kind of culture with accessing mental health care or healthcare in general?
Mm. Well, um,
Making you think for this one.
I think, well, I guess I'll make a plug for my colleagues' efforts, right? So we know that representation of Latinos in medicine is so low. So physicians in general, we have about 6% Latinos in medicine when we have almost 20% of the population, right, is Latino. And then within our Latino community, Mexican Americans tend to be the lowest represented in medicine as well.
Mm,
And so we know representation really truly matters. I can tell you as a fact, I would not be here if there had not been Black and brown women pulling me along the way. I can reassure you. And I would include
yep.
even some brown men. Actually, my college mentor was a Muslim professor, and he was wonderful and really pulled me up so heavily. And so representation truly matters. But in clinical practice, I think we want to see ourselves, we want to hear ourselves in a way that is, liberating and really takes into account these very intersectional lives that we are now living. Like in the United States, we have possibilities, right, of being. And so
Yeah.
we need
Yeah.
clinicians who can accept all of that, not put us into a box, but really explore with us everything that can come with it. And I heard your episode, Dr. Nasir, and it's just like, it's very similar, I think, to right, to the Asian community in some way. And so,
Yeah.
yeah, I would say that representation is absolutely necessary for us to pull more Latinas into mental health care when they need it.
Yeah. We know that's definitely like one of the hurdles that's there. Again, so many times, and I'm sure you get this message just as much, if not more than I do, of like, oh, I want to work with you
Mm.
versus like maybe the white colleague that's there, right? Because it's like, oh, you look like me, or you're somebody that I can who understands the culture, understands the background, is like that barrier kind of gets lowered when you don't have to explain things, right? As much about things that are, more culturally unique per
Well, and
se.
it's real funny if you think about it, because in some way we have all internalized racism, right? And so, as you probably know,
Mm.
some people from our community probably do seek out those white clinicians, and that is totally cool. But for those who are
Yeah.
seeking out those, those of us who represent their culture more fully, it's really nice to be there when they look for us.
Yeah. It's necessary too. So
Absolutely.
going back a bit with like you're talking about one of the things you do is like holistic approaches to treatment. So not just the medicine, right? Um, Tell us about that. Like, what are some of the things that you do that you bring in there that are not just medicine?
Yeah. Well, like I said, clinical practice in traditional models doesn't really lend itself to that, right? And so that's why I'm trying to create different ways, or trying to bring this knowledge in different um, settings or projects, right? And so um, you probably have seen, all these like global and national organizations have the pillars of wellness, right? And we know that those are so
Right.
clear, and we all hear these things, but why is it so hard to practice it, right? And
Hmm.
so what's your favorite form of physical activity?
Like, I mean, I like working out.
You like
So
raising
I have
weights
like
and stuff?
a
Fit.
great, yeah, I have a garage gym. So I like to, throw some weights around and all that stuff. Yeah.
Okay. So very traditional US, right, American way of working out, and that's cool. That connected with
Yeah.
you. I would say, my dad had a big impact on my ability to foster that physical activity into my daily life. Where would you say yours comes from?
A lot of it, I think, comes from, in my previous life, I guess, being like an ex 300 pounder, being like a huge guy, and I think my personal kind of turning point was like in med school again during that surgery rotation, like being the med student on call over the weekend and having to be there for like an
Mm,
amputation of a diabetic foot. And I think at that point, it kind of like clicked for me that I was like, oh, this is like a young guy who's getting his foot amputated from diabetes. I was like, this could be me if I like continue down this pathway. And it was, around the time that I'd met, you know, the person who would become my wife. And, she's, I'm 6'4" and she's like, a 5'2" 100-pounder kind of thing. And I was like, it looks a little funky. So I was like, she was kind of pushing a little bit. So I was like, that was my kind of
mm.
push in there. And then started going to the gym and was like, oh, this is fantastic. I love this. This is great. I enjoy this. And just kind of went from there.
Thank you for sharing that, because from my
Yeah.
perspective, I do find that most people will make those lifestyle changes when something like that happens. Like something finally clicks for you. So the reason why I am bringing these like pillars of wellness, which include things like nutrition, physical activity,
Yeah.
healthy sleep, healthy relationships, access to nature, right? Like these are, from my perspective, human rights that we can all kind of think about when it comes to our overall health, not just mental health, although they have a big impact on
Right.
our mental health. But the idea here is that if your parents, your family fosters an active lifestyle, and you don't have to grow up and eventually say, why am I eating all this stuff? Why am I eating this way? Or how come I don't exercise? And, it
Yeah.
just kind of is part of how you live your life. And you don't have to think twice once you get to adulthood, because we know from research, right, that the earlier we start, the better. Although there's really positive research showing that no matter when you start, it's really, really good for you to start at any point, right?
Yeah.
Doesn't
No matter.
doesn't
Yeah.
matter the
Yeah.
age or the severity of the situation. So I practice yoga. I think it's like a beautiful practice that incorporates a lot of the intersectional factors impacting our mental health. So there's physical activity in it. There is breathing and incorporating your breathing into your actions, to your movements. There is the
Mhm.
cognitive attention, being present in the moment, so that mindfulness aspect, right? There is the spiritual aspect, if you want to pursue it that way, right? Where you are no longer just doing it just because it's going to bulk you up, but you're actually doing it because it's something beautiful that your body can do, can accomplish, and can take you through a journey, right? So I think yoga in general is beautiful,
Yeah.
but it can also incorporate a lot of the wellness practices that people need to foster good mental health in their lives.
Yeah. Yoga is, I mean, we definitely, that's part of our programming over at the
Mm,
PHP. Like there's like a yoga instructor that comes, the kids, the teens get to do that for like an hour or whatever it is. And it's like, you see there's a difference that
mm.
definitely comes from participating in it and doing it. And um, it does have a lot of those things that you described, the mindfulness that's there, the physical activity is there. So
And that's
good,
new
good, good.
stuff that we're
Yeah.
seeing in clinical practice. When I was in residency and fellowship, I don't think I saw that a lot. And so I do, I just want to make this plug for those of us who are doing this important work when it comes to social justice. There is change happening little by little in small doses, right? Like we're not seeing this drastic systemic change that we want to see, but there is that awareness and trying to incorporate it and pushing it forward little by little. So thank you for sharing that. That makes me happy to hear that.
Yeah, no, it's definitely, again, we see all the criticisms and stuff that's online of like, oh, again, we just throw the medicines, and it's like, no, we do all these other things that are there, and we always, of course, we incorporate all these things into part of the treatment plan and
Yeah.
how we can help somebody
But
out. So,
your question was how do I incorporate into my clinical practice? And I think it's really hard, but I will bring in mindfulness. And if the child, if the kid
mhm,
is interested, I can incorporate it. It doesn't have to be like a full-blown yoga practice, but it can be a two
right.
minute stretch and wellness component to your interaction with them. And a lot of them are very welcoming of that.
Yeah, and I think when people say the word mindfulness or meditation, there's like a picture that shows up. They get the not to use the words, but like the guided message or the guided imagery of like the person who's sitting in like their room, they're cross-legged and they're like saying ohms and like, oh, that's mindfulness and meditation and that's yoga. And I don't want to do that because that looks stupid and that doesn't work for me. And the idea is that like mindfulness can be anything, right? It's so many things as mindfulness. Like, and people are like, oh, what do you mean when you say that? It's like when I would make coffee, right? If I'm like, and I'm old school and snobby with the coffee, but I'll grind my beans by hand. I have like
By
a hand
hand,
grinder. I
okay.
grind them out. Then I do like I use a pour over, so I get the filter, and you boil the water, and you weigh it out, and you pour. There's three different pours that come along for it, and you have to wait, and give like a little time in between everything. And it's like when you go through that process, like 4 or 5 minute process to make a cup of coffee versus just throw the pot in the machine and push a button. That's mindfulness, right? When you are, again, going to the gym and you're like doing your sets and then you have your break in between your rest periods, like that's mindfulness, right? So mindfulness shows up in all these different ways that we just don't think about it.
Absolutely, absolutely. I like to tell people there's two ways to think about mindfulness and meditation. There's formal meditation practice, like you're saying, what we usually think about, sitting cross-legged and chanting or just sitting peacefully, quietly. But mindfulness is your whole day. It just means being present with whatever is showing up in a non-judgmental manner that, allows you to just move through the motions peacefully, non-judgmentally, without attachment. That's really what it is. It's really simple stuff, but hard to embody and practice.
Yeah, and I think once we just kind of like reshape the way, hopefully that like our patients or anybody else or ourselves, right, just kind of look at it and understand that like, oh wait, this is what it is, and this
Yeah.
is how it can be helpful for us. Like it can make a world of a difference.
Well,
So
and if you'll allow me,
cool.
I would add there that
Yeah.
in our era of nonstop social media and like tech distractions, being a mindful
Oh yeah.
person is actually going to be a virtue, right? Like you are going to now have superpowers to be a human being and being present
Yeah.
with others as opposed to being constantly distracted, which I think we all know what that can look like. So it's
Yeah.
going to be a superpower.
Yeah. Yeah. There was like I joke about it. There's this book that I had bought that I'm still waiting to read, which is like How to Do Nothing.
Mm.
That was the name of the book. And I was like, I keep looking at the cover. I'm like, one day I'll get around
It's hard
to
for
reading
those of
you. But
us
it's like,
who are constantly on the go. We love to do things, but even as you're doing things, that's mindfulness, right? That's what you were saying. Like it's not
mhm,
doing nothing. There's power in that. But even as you're
yeah, yeah,
doing things, being mindful of what you're doing.
yeah. Makes a big difference. So like even little things like I think, eating dinner or eating
Hmm.
lunch like without your phone or not in front of a computer or not at your desk doing work, like just sitting and eating, like that's an act of
Hmm.
mindfulness.
Yeah, absolutely.
So
Having a conversation with your partner. in a way
Yeah.
that truly is listening and being present and holding space for each other. We all could use some skills like that.
Shifting gears a little bit, um, talk to us a little bit about your work now. So with like the forensics and then the immigrations and the sound that you were talking about, talk about that a little bit because you're based out in Texas, correct? So you have a little stuff is going on over there, right?
There's always stuff going on, unfortunately. And I think those of us who are doing this work always wish we could do more, always. And so I guess I don't even know where to start. Maybe I'll share 3 ways for anyone interested in working with this community and possibly forensic psychiatry. I can mention 3 ways that I'm using this expertise. So on one
Yeah,
hand, as an academician, um, for the past 3.5 years, I have been working on forging a relationship between an academic institution and a national organization that trains and supports clinicians to use your medical expertise to offer asylum medical evaluations to support asylum seekers in their legal process. And so that uh, process has been finalized after 3.5 years. I'm so proud. And so
nice.
thank you.
Congratulations.
It's really been a journey. And I'm so proud. I think that we have a lot of physicians who want to do this work. And so this is just one avenue that
Yeah,
you can get the training, get connected to lawyers, and support these individuals. The other thing is I do my forensic private practice, and so I might do some asylum evaluations or other cases on the side. And lastly, I would say, I use my clinical expertise to support immigrant and asylum seeking populations in the community. And so um, I will seek partnerships with nonprofit organizations or schools who have a high number of asylum seekers, for example, and offer spaces or workshops or presentations to support those communities. And I love all of this work.
nice. So for people who may not be aware, not know, what would be, I guess, what is forensic psychiatry and then kind of like some of the work on a day to day, what does that look like for you?
Mm. So, forensic psychiatry, in its most basic form, is the interaction of clinical psychiatric practice and knowledge with the legal system. And so, you are providing evaluations, not care, evaluations, to use your clinical expertise as a mental health clinician and explain to the court or lawyers or whatever mechanism through the legal system why mental health may be impacting the individual
Yeah.
and whatever legal situation they're dealing with. We bring in psychology and sociology, and there's forensic psychologists as well, right, that they bring their own expertise to the table. It's a really cool field that I love as somebody who is working in the interaction of different systems. I think it's a really powerful field. And your second question was, I forgot. Oh, what does it look like day to day?
Day to day. Yeah.
So for me, it's a very small part of my overall work. But if you are going to practice forensic psychiatry, at least 25% of your 100% work, it's going to be a lot of evaluation and report writing, and then a
Yeah.
little bit
Yep.
of possibility for court testimony, which is always fun, I think.
Yeah. I think there's a lot of people who get
Yes.
afraid. But they're like, "Oh, I don't wanna go to court. I don't wanna end up on court. I don't wanna end up on trial or anything." I was like, "It doesn't always go like that at all, though."
Usually, yeah, most of the time you don't get asked to go to court, but even if you go, honestly, you do it once or twice and then you get more comfortable being in that position and lending your expertise. Is not about you, it's really about lending your
Yeah.
expertise to the case.
Yeah. Tell us about how the field can be more inclusive, advocating for, like, racial, gender equity. all of that. What are some steps that can be done to help out with that?
Oh my goodness, so much. Where do I start? um,
Maybe from what you
I'll
see
give an
or what you can
example
do.
that actually came up this week. I attended a training for a mental health intervention, and we were told, just to give you an example, we were told that, this is for children who have a mental health condition, and ultimately it doesn't really matter what like the family dynamics are like. Whoever is there to engage with this intervention can go ahead. And I think, sometimes we have to do that. We have to get really concrete and really specific, and I get that. But from my perspective, given all the teaching that a lot of us have been trying to do, you can no longer be
Yeah.
saying these things. Like, you cannot be talking about evidence-based interventions without considering the socio-political climate that impacts children and families, right? And so, like, you can't tell a mom to go and take this skill home, for example, when
Yeah.
there's violence going on in the home, and you're not talking about women's rights and safety, right? I mean, there's just so many layers that, right, like that you can think about. And so, number one, I think just being very mindful that as clinicians, especially if you're a researcher and treatment developer, you cannot be
Yeah.
ignoring sociopolitical layers and climate surrounding your intervention. And you have to at least acknowledge what has not been studied and considered in the process, right? Um, so I'll stop there because there's a lot I could say. I'll stop there.
No, there is a lot because again, we see this a lot with a lot of the research and all the treatments that are there, again, are coming from a certain demographic and a certain point of view of how things should be. And a lot of things, there's again exactly what you're describing is unique circumstances, which are not super unique, but at the same time, very, they're unique in certain situations or areas of the world. But they really generalize to a majority of the people that we actually work with
Yes.
clinically, right? Um, versus like the nice suburban type of people that people may be getting research or evidence or whatever for. So cool. Tell us about, so you have a Teku, right? Am I
Mhm.
saying that correctly? Teku, tell me about that. So what is that? Because you run that. You're the CEO.
Well, so I've been on this journey for about a year and a half. So I would say, it's still in its early stages, baby stages, but we are building a virtual platform, currently website based, that is promoting child and family mental health, trying to accomplish this in a holistic perspective, as well as an intersectional, from an intersectional standpoint. And so, what we have right now is an online course and community for parents and caregivers of, kids 18 and under who want to connect with other community members, but also receive some support and education surrounding just foundational tools that can foster everyone's wellness. So again, talking about the 8 pillars, right, of wellness, healthy relationships are one of them. And what do we know about healthy relationships? Well, there's foundational things, right, that make up healthy relationships.
Yeah.
And yes, you can
Yeah.
go further for different populations, but the foundational needs are there. So that's what we're trying to do. That's what we have to offer at this time. But we're also building sub communities. So talking about kind of equity, right? So there's something that applies to every
Yeah.
single human being. And then there's layers that impact certain communities differently. And so right now we have like a general community, everyone is welcome. But we're also building, sub communities because of my expertise, starting with the immigrant community, the asylum seeking community, but also with families interacting with the juvenile legal system.
How's that been? What's the reception of it been so far, or how do you feel like that's been going?
The reception, I think, is great among clinicians and community leaders. We
Mhm.
literally just launched our virtual offerings this month. And
Oh,
yeah, so
nice. Okay.
it's really new, but it's been like a year and a half journey because, as you know, like these projects take a
Yeah.
long time. And we have actually been
Yep.
piloting the programming live. And so the live work has
Yeah.
been going on, but the virtual community, that's just been launched over the past month. Um, I think there's
Nice.
very positive reception for what we're offering, and definitely a lot of excitement for what's to come, specifically for specific communities.
Nice. Good. Good. No, I think it's kind of aligning with the future, right, of care and how we want to
Mm.
deliver care, and then kind of like what you're saying with the family mental health, because this is a way that we can engage people
Hmm.
early, and even going like with equity, right? We're trying to break down barriers or access, and as long as we're able to kind of have some kind of community knowledge and community resources, that's what you're really looking for, right? To make things equitable.
Absolutely. It's like opening the door and letting them in, guiding them to the next step if it's needed, right? But it's that initial stage that we're lacking in traditional healthcare models.
Nice. Okay, good. Well, good luck
Thank
with
you.
everything with that. Hopefully it goes and goes and goes, because I think it is invaluable, and I think there's a good kind of model for reaching these populations that we're looking for.
Yeah, I think thank
So,
you. I appreciate that. It's a journey, a challenging journey to
yeah.
say the least, but it's also fun, and really there's a lot of learning that's happening. So I appreciate that.
Yeah. You had said before also, like, you're pushing and learning, kind of getting out there a little bit. What have been some of the challenges that you've found with exploring, again, ways of bringing your clinical expertise
Mm.
or your background into other parts of the world, or trying to marry those things
Mm.
together?
Well, um, I do a little bit of consulting with a super awesome um, mental health policy institute, and they have their hands like all over the place with cool initiatives throughout Texas.
Yeah.
So that's one way that clinicians can do that. Um, I also do a lot of volunteer, but important work serving in committees, right? And so, whether it's an academic committee, whether it's a local city based city government committee, I think all of these things are really important because we need to have our voices heard as child psychiatrists. We bring a really
Yeah.
holistic and complete perspective regarding child and family mental health. And so I think we need to be in
Yep.
all different spaces. I guess, or I would like to include, welcome your perspective too on, I think something I try to do a lot as a medical educator is share my perspective as a mother, because, nobody shares what it's
Mhm.
like to be a parent and a clinician, and the hardships that can come with that, right? And yes, primary and secondary caregivers, and there's different perspectives, but I'm wondering what would be some pearls you would like to share with people?
That it's hard, right? I think that it's not easy. I think I'm sure you kind of get asked this question a lot of times, and I get asked it all the time by when you're working as a child and adolescent psychiatrist, and you're telling parents what to do, right? Or at least that's how it's interpreted, right? Is that you're telling
Mm.
parents how they should parent their child. Don't you have kids? And what would happen with your kids if this, would you put your kids on medication? And again, that always kind of gets thrown at you of like, well, what would you do in this situation? Or what do you don't want to do? Or are you doing this? And, a lot of us are. A lot of us are dealing with that, right? A lot of us have our own stuff. And I think, patients will sometimes say things like, "Oh, well, you seem to be living like this perfect life." And I was like, "You don't know that. You don't know what's going on in my life,
Mm,
right?" Purposely, right? We're kind of told in a way to like keep things on our end, but you don't know if I like just came from having my daughter's wisdom teeth pulled, or not her wisdom teeth, just like having her teeth pulled at like 6 years old, and having her crying in my arms, and her blood is still like on my pants, and now I'm showing up in clinic an hour later, and like I have to like work with your kids. Like, you don't know that part, right? That's something that
mm,
happened to me like in, during the school year. Or you don't know if my kiddo's sick, when my I can say like when my was it when she my first daughter, when she was like 2 months old, was in the hospitalized for like
mm.
meningitis, and was in the hospital for 2 weeks getting, IV antibiotics. And like, I was in residency at the time, fellowship. I still had to like go into the hospital every day and like do all this stuff over there. And it's like, that's, we still do this. We're parents. A lot of us, a fair amount of us are parents as well. And, we're not trying to tell you how to parent your kids, right? We're offering
Mm.
suggestions and some of that aspect.
Wow, that's yeah. I I think there's two populations we're talking about here. I guess one is the patients, and I would say,
Yeah.
I personally feel that this is my personal perspective. Okay, I personally feel that I probably
Yeah.
did some harm, just like judgment, right? You really have no idea. You truly have no idea, and
Yeah.
especially now that I have kind of developed this more family holistic perspective. I do think that
Yeah.
we have to be just very mindful, right? And I think this is one of the meaningful disclosures that I do have 4 kids, including an 8-month-old, right? Like, I hear you. Things are
Yeah.
really challenging. Like, this is a hard decision to make, right? Um, and then
Yeah.
also, I would like for trainees to see you having those conversations and saying, like, this is tough to be a parent, like what you're going through, like this is a really hard situation. And
Yeah.
your family's needs best, right? And so to also instill in trainees, as well as share with them, my kid is in the
Yeah.
hospital and I do have to be in clinical services right now. And what does that mean for them? Because we're talking a lot about changing the system, the culture, right? So that's an interesting
Oh
conversation,
yeah.
always worth having.
Even like, I'm talking about like almost from talking to other parents' point of view, right? For the parents of our patients. And sometimes like even it's difficult where we're working with like the peers of some of times our own kids, or kids who go to our
Mm,
own our kids' schools. And that can be hard. And there's that aspect where it's like, oh damn, like, is this, can I see my kids in this
mm,
position? So it is tough. There's definitely that aspect. And I know you said about harm. Like, I think also for people who are in the field, I think a lot of it may just be me, but a lot of psychiatrists too, they're talking all day, or they're listening to people talk
mm.
all day, right? And they want to come when they come home, they want to just come home to quiet. Or want things to just be quiet at home, right? And again, it may just be me. You can feel free to tell me otherwise. But like, sometimes like I feel like I shortchange my kids'
Mm.
experience because I'm like, I just want things to be quiet. I just want things to be quiet. And I was like, and I have to remember, I was like, kids are kids, right? I'm telling parents all day, kids will be kids, and they're going to be loud, and they're going to be annoying, and they're going to be whatever. But I was like, then my expectations for my own kids become
Well, and
different,
that's where
right?
you take that personal experience to truly understand how hard it is to do what we're
Yeah.
preaching, right? And so I think that, like,
Yeah.
that's what I'm doing with Teku. Like, I'm going in there as yes, I'm a
Yeah.
clinician. Yes, I have this knowledge, but I'm a mom. And I know how hard it is to
Yeah.
transition from work to kids, to be a wife, to be, right? Like, it's a lot. And so I'm going in there more as a human being, and that's what I need to be more of a human
Yeah.
being.
Yeah. I think we could all benefit from that, right? And turning off like the go go go
Hmm.
engine and culture that's there
that
so much.
mindfulness
So
that we have to bring home and be like, I might just step out to the backyard while you guys have a lot of fun. That's okay too.
no, totally, totally. So it's do as I say, not as I do, right? So cool. All right. Well, we'll wrap up a little bit, but last couple questions I always ask people is like, what is your versions of self-care? What do you do for yourself for self-care? We're talking about it a
Yeah.
bit. So
So much, I would say so much. I do so much, honestly. I absolutely need my exercise and my physical activity, and I have like a few that I kind of rotate just based on my needs. Sometimes I'll go on a bike ride or running or yoga or whatever it is. Um, and I mean, I have to take care of my health. I can't. I have no
yeah,
option. I have no choice. I will get depressed and I will get very anxious. So, I would say exercise and mindfulness are my top two that I employ on a regular basis.
nice, good. And last question is favorite pair of sneakers.
I forgot to prepare for this one because I'm so lame and I don't have sneakers. Okay, don't judge me. Don't judge
Ah,
me, but I am not a fashionable person. So I tell everybody my sister goes shopping for me. So I have no
okay.
idea, but I love yours, okay?
Well, that works. Cool, cool, cool. How can people follow along with your journey and help out with what you're doing too?
Yes, I
Some ways to connect or
definitely
follow.
love connecting with people on social media. I am on Twitter, Instagram at Barbara Robles MD, and I am on LinkedIn. And you can definitely check out our website, www.jointeku.com. Please connect if you are a nonprofit serving, LGBTQ youth, immigrants, juvenile legal system impacted families. Reach out to me. I would love to hear from you.
Awesome, awesome. Well, thank you so much for your time. And we will definitely support and help out every way, which way
Thank
we
you.
can. So looking forward to what you guys
Thank
are
you for
doing.
having me. It was great chatting with you.